The most important thing for patients and families to keep in mind from my standpoint is we understand you're not physicians. So we don't necessarily want you having to delineate between, is my loved one having an ischemic stroke where a blood vessel is blocked, or is my loved one having a hemorrhagic stroke where a blood vessel ruptures? So if you think about the symptoms, signs and symptoms, there is a wonderful an acronym, B.F.A.S.T. We want our patients and families to be fast in recognition of a stroke. We want them to be fast in coming into the hospital, and we want to be fast in our treatment to give them the best possible opportunity for a good outcome. So B stands for balance. The E stands for eyes. So if you're having double vision, if you're having loss of vision, if you're having any type of symptomatology where your vision is different than normal. The F stands for face, so facial asymmetry, facial droop. A stands for arm or appendage, where you can have weakness of your arm or your leg. A lot of times you may have face, arm, and leg involvement. S stands for speech, so any difficulty with generating speech, slurring your words, difficulty with understanding speech, or difficulty with generating speech, any of those can possibly be the symptomatology of a stroke. T stands for time. So a very important point in understanding stroke is time is equal to brain. So every minute that the brain is without oxygen, up to 2 million brain cells can be irreversibly injured. So that means that if somebody were to come in and there will be 60 minutes between them having symptoms and getting into the hospital and getting treated, you can have still up to 120 million brain cells that can be permanently injured. So it lets you know how important the time element is. And the last T stands for terrible headache. Bleeding strokes or hemorrhagic strokes can present themselves with a terrible headache. Usually people will say it's the worst headache of my life. Again, come in immediately so that you can be properly evaluated. We want you to be fast.